This is Sheila Parker from Talk of the Town, and today we have two wonderful ladies with us from our community. One is Dr. Irma Mahone, Assistant Research Professor in the Prostate Cancer Research Study. And the other one is Gail Russell, who does walkathons. So let me introduce to you Irma Mahone. Irma, welcome to our show today. Tell us a little bit about yourself, about this CPN study. What does it stand for and what does it mean?
The CPN study is the Cancer Patient Navigation Study, and it is an investigation of how best to help African American cancer patients over the age of 60 have an improved experience during and after cancer treatment.
Very interesting. And what all does it entail?
Well, the term patient navigation is a term that has been used quite a bit recently just to describe the challenge facing any patient who is needing health care and just having to navigate what is a maze in terms of finding suitable providers and then getting lab work or diagnostic tests and then getting treatment and where to go for which treatment, and then not to mention the complications of insurance and other financial concerns. So any patient has a real challenge navigating the system, so to speak. And cancer patients have additional considerations which makes it even more complicated, such as the concerns about the prognosis and then the many different kinds of treatments that they have to choose from, and then having to deal with side effects and just having to find out where they can get all the support that they need to make it through all of that.
Irma, can anybody participate, and how would one become involved? What is the criteria for becoming involved in your study?
Well, like I said, this is a study of African Americans over the age of 60. Over 60. And so let me go over the eligibility criteria, so that will tell you exactly who we are looking to recruit in this study. African Americans over the age of 60 living in rural Virginia, recently diagnosed with breast cancer or prostate cancer, that is within the last 2 months, and also able to identify a support person to work with through the study. Those are the eligibility criteria. And if you qualify, or if you know of someone who qualifies, who meets that eligibility criteria, we would just look for them to volunteer to participate in this study.
So if they wanted to volunteer, who would they contact, and what is the process of getting involved in this?
The way to be in touch with us is to call us, call on my phone at UVA School of Nursing. The number is 434-982-1805. Or a second way that you can get in touch with us and volunteer to participate in this study is to go to our website, which is CPN Study, that is cpnstudy.org. And on the first page, as soon as you open that page, there will be an opportunity, if you would like, to just put your name in there. And that doesn't obligate you to anything, but that puts you in touch with us, and then we can begin the process from there.
Oh, very good. Thank you. As a participant of this study, what is expected of the volunteers?
This study is going to be measuring the outcomes, the effects of an intervention, which is primarily, the intervention consists of a community health worker being assigned to the participant to be in touch with them by telephone every 2 weeks, to offer additional guidance and support as they navigate the healthcare system. That is the intervention. If you volunteer for the study, you would be randomized to either the treatment group or a control group. And if you're randomized to the treatment group, you would get this intervention. You would be asked to complete questionnaires at the outset. We call that the baseline measures. And then halfway through the study, and then at the end of your treatment, or extending perhaps a month beyond the completion of your treatment. So you would complete these questionnaires, which would tell us whether you're doing better with this kind of support
Right.
or without it. That is essentially what the study is.
Is there going to be any kind of compensations for the volunteers?
Yes. You would be paid $25 for doing the baseline evaluation and $25 for the second evaluation, and then $50 for the third evaluation at the end of the study. So there will also be opportunities, not for everyone, but if you volunteer to participate in some of these focus groups that we will do, there would be additional compensation for that.
Tell us a little bit, Irma, why is this kind of study work so vitally important?
Well, this is an important study because of a number of things. First of all, we know from the statistics, just the demographics of the United States, that the elderly population is growing rapidly. I think it was the 2000 census that had over 12% of the U.S. population over the age of 65, and this is expected to double by 2020. And these numbers are growing more rapidly in the African American population. So then you look at the number of just the statistics around the morbidity and the mortality of cancer diagnosis in this population, and it is much higher for people over the age of 65, and it is even higher for African Americans over the age of 65. And then you add the variable of living in a rural area with limited access and limited resources. People that we are looking to study in this particular investigation really have a lot of disadvantages, and we're looking for ways to support them better because of all these disadvantages.
How long is this study going to last? I mean, is it for a year, or is it for 6 months, or how long?
It will be at least 2 years and maybe as much as 3 years. And people who volunteer to participate, they would participate until they complete their treatment and then a month beyond that.
So can a volunteer sign up anytime? Can they call you 6 months from now, or does it have to be this particular month of December and then they commit themselves? Or?
People can sign up anytime, and I expect we will be recruiting subjects for the next year or two. We are looking to recruit a total of 80 participants. I should say that this is a study that originated out of the Johns Hopkins School of Nursing, and UVA School of Nursing is a secondary site. So between the two sites, we are looking for 80 volunteers to participate in this study.
Do you I'm sorry, go ahead.
And we will continue recruiting until we reach our targeted enrollment.
So are you close to your targeted enrollment at this point?
No, we are just beginning this study. So we are looking to enroll our first participant.
Very good. Good luck. Now, if you had to give 3 bits of information out of this entire study, or information that you would like to pass on to our viewers, what would it be?
I would like to say that the purpose of this study is to test an intervention to provide culturally appropriate navigation support for rural African American elders undergoing treatment for cancer. And we really anticipate that findings from this study will help improve the care of elderly African American patients with cancer diagnosis. And number 3, we really expect that probably the most effective way for recruiting subjects for this study will be by word of mouth. And so we hope that people get excited about this study and help us identify persons who would be eligible for it.
Wonderful. It sounds like such an interesting study and definitely very important to our community. Would you say?
Thank you. Absolutely. There is just so much need to look at ways to improve the care for this population. And we know that the criteria is kind of gives us kind of a narrow group of people that we're looking at, but we really want to examine these factors, these variables that contribute to present barriers for people with these diagnoses to get the care and support that they need.
Okay. Is there anything else you would like to tell us about this study that you might think would be useful for our viewers here today?
idea is out there sometimes that we want to use volunteers as guinea pigs. I just want to say that our goal is to improve the care, the services, and the support that this population need when they find themselves diagnosed with these diagnoses. And so if you find it in your heart to support this, we would really appreciate you volunteering to participate in this study.
This is very good information, because you're right, a lot of people would think we're guinea pigs. And then, of course, that's an important piece of information you gave there, saying that this is not the case nowadays. Well, Irma, I'd like to thank you for the information. It's definitely been very helpful.
My pleasure.